Welcome to Next Steps to Leadership with your host, Dr. Stephen Oliver. In each episode, we invite experts to share their passion and their leadership journey to help you in your next steps. You can find this show on YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, hrcvision.com. Now here's the host of Next Steps to Leadership, Dr. Stephen Oliver.
Well, hello and welcome. Welcome to my podcast, Next Steps to Leadership. It's really nice to have all of you. As mentioned, I'm Dr. Stephen Oliver, or known as Dr. O. I am both an academic professor at the University of Pennsylvania and the University of Virginia, and I am a leadership and human resource consultant. And in my podcast, I'm inviting some really fantastic and wonderful leaders to talk a little bit about what they do, their passion, and some of the things that they contribute to leadership. It is my honor to have a colleague and friend, Aliza Narva. She is the Director of Ethics at the University of Pennsylvania Medical System, or it's called Penn Medicine, here in Philadelphia. We're in Philadelphia, and she is both a nurse and a attorney. And she comes to, I have two ethics classes, both at the University of Pennsylvania Graduate School of Nursing, and I also have a undergraduate ethics class in healthcare at the University of Virginia for predominantly allied health students. They're trying to get their bachelor's. And so Aliza is so gracious and comes in and guest lectures, and we talk about ethics. Boy, has it been interesting in the past couple of years, some of the ethical things that we've talked about. So welcome today, Aliza. How are you? How's it going?
Hi, Dr. O. Thank you so much for having me. I'm really excited to have a conversation with you. Everything is great here.
It's great. Fantastic. Well, what we're going to do is we're just going to talk a little bit about ethics and how ethics relates to leadership. You're here looking at our podcast, and how can ethics connect to what you do? We're going to focus on hospitals, healthcare, nursing, doctors, but this discussion can also translate to other disciplines, other industries. Ethics is a challenging issue right now. So I just wanted to see, Aliza, if you could just say a little bit more, first of all, about yourself, who you are, what you do, and what's going on with you.
Yes. So I can tell you a little bit about my background. I moved to Philadelphia in 2002 to go to law school at the University of Pennsylvania. I went to law school. I practiced as a couple years as an attorney here in Philadelphia at a large law firm. And what I realized pretty quickly was that being an attorney and being in litigation did not seem like a very effective way to problem solve. It felt very antagonistic. It felt very uncomfortable for me. And I realized that I wanted to be in a field that was more collaborative when it came to problem solving. And so I went back to school to be a nurse. I fell completely in love with nursing and clinical nursing. As a student nurse, I started to work on a med-surg floor at the hospital of the University of Pennsylvania. And it became apparent to me very, very quickly that a lot of complex problem solving was happening in that environment with a lot of different stakeholders who had different ideas of how to get to the right outcome. And as a new to practice nurse, I rallied our clinical director of nursing to allow me to become a member of the ethics committee. I got additional ethics training so that I could do ethics consultation, which I can talk about in a little while. And I also became a nurse leader. I was a nurse manager for a number of years. So that basically means I was in charge of a large nursing unit, and that looks like doing all the administrative running of the unit, managing a large staff of nurses and others, right? Doing the hiring, doing the firing, but also providing a cultural example, and really helping a unit develop a personality and a unified approach to how we manage patients and families, as well as all of the different professionals who are in that space. I think in healthcare, that's really a challenge, but I don't think that's limited to healthcare, right? I think trying to get a diverse group of stakeholders in any environment to work together towards an identified outcome can be a real challenge.
And I love what you said, patients, families, community. I mean, this is what's so important. A lot of people who are not in healthcare really relate. The patient goes in with the challenge, the problem, the diagnosis, and they're there. But it's really a partnership with families, even community members. And that's really important to include them in the care decision making, just that whole journey through the healthcare system. So I'm really glad that you said that. So, Eliza, I know this is really basic for our listeners, but what is ethics to you? What does that mean? I've got a definition which I can go over, but I'd like to hear yours.
Absolutely. So when I think about ethics, I actually think we need to start with values, right? Values are very personal. We all have our own values, and those are shaped by a lot of different factors: who we are, where we came from, whether or not we have religious beliefs, right? Our sexual identity, our gender identity, our race, all of these things from the time we're very small shape what we think is the right or good thing to do. When we expand that across a larger group, we think of morals, right? A moral is the right thing to do or the good thing to do, right? Morality is a belief system around what is the good or right thing to do. Ethics is the study of morality. So when we think about ethics, we're thinking about why is that the right thing to do, right? If morality is this is what the right thing is to do, right? I'm going to help this little old lady across the street. That's the right thing to do. The ethics of that are why is that the right thing to do,
Mhm.
right? And so when I think about healthcare or actually any workplace or any situation where there's a lot of fast occurring decision making happening, I think it's really vital to have a structure in place for thinking about why we're doing what we're doing. And that is what ethics provides. It provides a framework or a structure for thinking through how do we decide what the right thing is to do in a given situation.
Fantastic. And, I just brought up my definition on my phone and now it just disappeared. Okay, here it is. Again, ethics as a definition from an online Oxford dictionary: moral principles that govern a person's behavior or the conducting of an activity. Medical ethics also enter into the question. So, there is some differences in medical ethics. The branch of knowledge that deals with more principles. So just I think it's great to set the stage, for this discussion. What is ethics, and it's all about morals, and it can differ from industry to industry, from person to person.
Mhm.
Um, you can have the same large healthcare organization, and some ethical decisions can be different. So I like the way that you said that. Um,
Absolutely. And if you don't mind, I want to
sure.
clarify a little bit. If you think about, I might have my own moral code, right, as an
Mhm,
individual. And then as a nurse, I have a larger code of ethics, right? I have a
mhm,
code of ethics that is nationwide. It's sort of
mhm,
a professional promise that nurses make to the public, to themselves, to each other about who we are and what we will do. But I'm also existing in a larger ecosystem with
mhm,
physicians, say, and respiratory therapists. And those groups have their own codes of ethics, right, that are slightly different than my code of ethics as a nurse. And then we're all in the hospital, right? And the hospital system has a whole different code of ethics, has a whole
mhm,
different set of values and morals. And so it can become quite complex. And I think that's actually very similar to a lot of places where people
mhm.
are working. You have individual, professional, organizational values that you're sort of trying to wrestle all the time.
And additionally, adding to what I heard you say is ethics can be driven by the nature of your job.
Yeah.
And if you're in the emergency room, acute care, that can be very different than
Mhm.
working with a cancer patient or a child, who's recovering from something. So that's really important that you made that distinction there. So, Eliza, tell us, what in the world do you do as director of ethics? I mean, I know you've talked to me quite a bit in the classes, but let's share with the group here. What do you do as a director of ethics?
Absolutely. So, I think a lot of people who aren't as acquainted with ethics assume that I do regulatory work, right? That I am in charge of HR or do work along those lines. And that is actually not true. I work closely with HR, I work closely with our attorneys, but I am lucky enough to do ethics all the time. And what that means is I run our hospital ethics committee. And I run our ethics consultation service. And these are two mechanisms that really exist to help with complex decision making in the clinical setting. So I get to do those things. I do a tremendous amount of education, which I love. And I get to be involved in complicated problem solving with a lot of stakeholders. So if you think about ethics consultation is something that is fairly new, right? If we back up a little bit, bioethics is a pretty new field. Bioethics, actually, which is the study of how biology interacts with technology, right? How human life interacts with invention and advancement in things like critical care, that only emerged in the middle of the 20th century. Right, that is something that sort of emerged out of World War II, and then through the second half of the 20th century, as we began to develop all of these technologies that could prolong human life. It became apparent really quickly that we needed to have systems in place for deciding who got access to those technologies. Right, if you think about the origin of dialysis, say, which was sort of the first time when we realized, wait a minute, we need real experts in this space deciding how to use dialysis because a lot of people want it, but we only have a limited amount of dialysis machines. That was sort of the way that bioethics started. We need experts in this space to figure out who gets dialysis. And so as these technologies have advanced, we've needed better and more well-trained resources for thinking about how we use them. And so what I get to do in the clinical setting is help patients and families and doctors and nurses and others talk together in a safe space about who gets what, basically. And a big part of my job is bringing together experts. And so everyone thinks of nurses and doctors as experts. They know the science, they know the medicine. My job is also about saying, hey, patients and families are also experts, right? Patients and families are experts on their values, their desires, their goals. And without that part of the conversation, we can't make good decisions in clinical space. So a lot of my time is spent doing mediation and conflict resolution between and among, healthcare professionals and families, education on policies. During the COVID pandemic, especially in the first couple of years, we were making a lot of new policies to think about how we would allocate resources in a surge, right? As we remember in the beginning of the pandemic, there was a lot of fear around personal protective equipment and things like critical care beds and ventilators and all of these technologies that we realized pretty quickly were incredibly scarce and we might not have enough for everyone. And so there was a lot of policy making around that, which I still get to participate in. And then I'm involved in a lot of other hospital activities. I'm helping to lead our committee that's managing our approach to workplace violence, for instance. Involved in that kind of work. I'm a member of the nurse executive team, so I'm involved in the executive nursing work in the organization. I get to do a lot of really cool and interesting work.
Yeah. Well, two things I just wanted to mention before we move on. So you're talking about bioethics, and I think I'm gonna have another podcast with you about artificial intelligence because that's really growing everywhere. I'm seeing it from my side as a academic and a professor and a teacher, but certainly there's artificial intelligence as a clinician. So I think that takes your comment even further. We'll have to come back and do that. And then the second thing I wanted to comment on another question, you're talking about families and patients being involved in their care and asking them about difficult ethical questions. Why, again, and you kind of already said this, but why, again, is it so important for patients, families to be involved in those ethical decision making?
I mean, patients are the people who are getting the care, And actually, it's larger than that. For many patients, it's also about their family being included, right?
Yes.
For them as a support system, as sometimes for people that have been chronically ill, families may be the true clinical experts on how care happens for that patient. But if we think about sort of the core principles of bioethics that we have sort of decided are the core 4 principles, we think about autonomy first. And autonomy is really about making our own decisions, having control over our own bodies, having the opportunity to define what works for us and what doesn't work for us. And there are a couple court cases in the last 50 years that have really helped us define how we want to think about, as a society, the individual's right to decline certain life-sustaining therapies, for instance, or advocate to receive additional care. And so if we don't know what your goals of care are, right? Dr. O, if I don't know what outcome you want,
right,
it's very hard for me as a physician or as a clinician of any kind to understand what kind of care we should offer to you. Not everyone wants the same thing. And if I can understand from you, oh, Dr. O's goals are to be able to, when he's better, walk around Rittenhouse Square and eat dinner at Vetri, I can better understand what is medically appropriate for me to offer to you. Now, I think it's important to recognize that based on how ill you are, it may not be possible for you to get to that place where you're going to walk around Rittenhouse Square. And that's information that we have to talk about because it's going to impact what interventions are appropriate for you.
And by the way, Rittenhouse Square is a beautiful park in the middle of the city of Philadelphia, and Vetri is a high-end Italian restaurant, and I'm taking you as I'm walking around, so get ready.
Absolutely. Perfect.
But that's really important, the decision. And speaking of autonomy and some of the other principles of ethics, how do you make those really difficult decisions at HUP or Penn Medicine? How do you make those? I know you've talked a lot about COVID and some of the challenging decisions you all had to make and new policies, as you just articulated. But how do you go about those difficult decisions?
I think the decisions become clear if we make sure that all of the important stakeholders are at the table, right? And so what we're talking about here is shared decision making, which is sort of the contemporary model of how we make decisions about interventions and medical care. And that's what we've talked about a little in terms of, having person and family centered care, right? That the patient and the family, if they wish, are sort of core members of the clinical team who help decide what's appropriate. But obviously there are other people at the table too, and it's not just physicians, right? Nurses are key stakeholders, respiratory therapists can be key stakeholders, social workers are key stakeholders. And so part of my job when I get started in discussions around, say, a clinical conflict that's happening is to identify all the key stakeholders and make sure that we're all operating from the same set of facts, right? Most ethical issues in the clinical space actually come down to communication breakdown. We're not all on the same page. Somewhere along the line, someone's gotten something wrong, or the family is confused about something, or we've not included the family as much as we should. And so I think it's important to start from that place of like, let's actually make sure that we're talking to all the stakeholders because we might discover something really different.
Yeah, I mean, it's really important to hear what each person has to say and what their position is, because again, a doctor, a nurse, a radiologist, respiratory therapist are all looking at that issue from a different window, as are other companies and organizations. So, anything more you can speak about COVID and some of the challenging times for our audience? Because you visited my class several times, even during COVID, and I so appreciate that. But those were a tough time. Anything to relay about those decisions you all had to make?
Yeah, I mean, I would say one thing that was really important during early COVID, and I think this demonstrates the power of having an ethical framework, is that our ethical framework shifted. And we went from being very individualized, right? We think about our individual patients. We think about, if Dr. O is leaving the hospital, what are the things I can send home with him? Or how do we make clinical decisions about what we offer to Dr. O? We went from a very individualized ethical framework to a utilitarian framework. And we've never had to do that before. We went from what is the best thing for each of these patients to how do we prevent a catastrophe? What is the greatest good for the greatest number? And that was a really big shift. And also, one thing that was helpful, because there was a lot of distress around this, because a lot of healthcare providers felt like, hey, this is not the kind of care that I was trained to give. But once we could reframe that and say, what we're doing here is actually working as hard as we can to prevent catastrophe, to save as many lives as possible, right? To prevent as much sickness as possible. And so care looks a little bit different now. Providing that ethical framework was actually very helpful for folks because they were reoriented to what we were doing. It's a distressing time. Things changed, as you know, incredibly quickly. And so, especially for nurses who are used to spending a lot of time with patients and rounding on them every hour and spending a lot of time getting to know them, they were suddenly outside the room a lot more. Their patients were suddenly alone in their rooms a lot more. And so to be able to say, man, I know this is really hard. Let's talk through why we're doing this the way that we're doing this. It's very helpful.
And, even as you mentioned, some people communicating as they were coming to the end of their life with tablets, not even being able to hug and touch their loved one. So a tough time. You mentioned the other day as we were preparing for this, something about morality or a moral code or something that is kind of changing a little bit. I'm trying to, I'm forgetting the term, but I'm just curious if you had any thoughts about how ethics may be changing today as we go forward.
I'm not sure. I can't remember exactly what we were talking about.
Yeah,
I think
about
bioethics.
moralities and moral codes and just some things that may be shifting today in healthcare and in society.
Yeah, I mean, I think that's a challenge. I think if you look at the way that, and this has always happened, but I think there is right now a lot of disconnect between a lot of the legal system, I would say, and a lot of ethics. And so I think one thing one great example is after the Supreme Court overturned Roe v. Wade during the period of time where we were sort of wrestling with the Dobbs decision and recognizing there was no longer sort of a national right to abortion. That was a huge shift. And a lot of providers at a lot of non-religious organizations and hospitals were trying to wrestle with, how do we provide this evidence-based care in a situation where it's now illegal in our state and the law has not been made with any consultation with clinicians or any consultation around the actual science, right? So women ended their pregnancies for a lot of different reasons, but we also know that women who are having pregnancy emergencies or who are having miscarriages need physicians to take care of them that have those same skills. They're the same skills for abortion that are sometimes used in miscarriage or other pregnancy emergencies. And suddenly we're in a situation where it's harder to get that training. And what that is meaning and what we're seeing is that means that more women are dying in states where they shouldn't have to, where our obligations as healthcare providers is to help our individual patients and to provide the evidence-based care that they need. And so I think there are, I would say right now and this is always the case to some extent, but I think right now when you're looking at some of the legislation that's happening, that's purely political and actually not at all based on science, you're seeing more legal constraints that are around belief systems rather than where is the science taking us and what is the care that women and other pregnant people actually need. I don't know if that's what you were just talking about.
It connects to it. And, as you're talking, I would add not only to women's issues, just so many moral judgment things that are happening in our world. Certainly we've got war and strife. You look at politics on both sides of the aisle that are in question and judgment. My background's in human resources in healthcare, and I see unions and strikes and automobiles and in writers. And so I just look at a lot of ethical things that are challenging in our world today.
Mhm. Absolutely. There's a lot of push from all sides.
Yes, so we've got a lot of things that we can talk for another. I think we have 2 or 3 more podcasts. So just a few more things here. You do a lot of teaching and guest speaking, and just what are some of the messages you're conveying, Aliza? I mean, you've kind of threaded that through your discussion so far, but what are the messages you are delivering, and who are some of your audiences?
Yeah, no, that's great. So I teach, I am an adjunct professor in the medical school. I also teach in the nursing school here, both at Penn. And I also teach, I'm an instructor in our clinical conflict mediation program in our Department of Medical Ethics and Health Policy. And that is really about understanding the why behind why people are acting the way they're acting in the clinical setting, right? That is really the contemporary model of clinical ethics and ethics consultation, is understanding why people are asking for what they're asking for in the clinical setting. And I would say, right, there's a little bit of a practice in clinical care of sort of assuming that patients and families, when they don't agree with what we, the healthcare team, are proposing, that they are crazy, that they are difficult, right? And that they are in denial, all of these things. And part of my work, and I think this does sort of weave through all of my work, is trying to get folks to slow down and take a little bit of a trauma-informed perspective and ask themselves, why might this person be acting this way? It's probably not because they are a terrible person. I think to try to engage a little bit of empathy and be curious, and remember, when people are in the hospital, it might be the worst day of their life. They might be in pain. They might be terrified. They might feel totally out of control. They might be confused. Whereas for me, it's just Tuesday at work.
Right. Yes.
And so I think something that will be transformative in healthcare, and something that I'm working very hard on, is helping all clinicians, instead of going to that place of judgment and anger, to go to that place of, hey, what happened to this person that they're like this? This person doesn't have good coping tools. I wonder why. How do we work with them? Because it feels better for us as well. If I can make that empathetic connection with you, I am going to enjoy taking care of you more. I'm going to feel better about myself. Actually, the literature shows that I, as the nurse or physician, I'm going to be less likely to get burnt out.
Right. Yes.
To be morally distressed.
Burnout is huge everywhere, especially in healthcare.
It's a crisis.
Yes. Aliza, do you mind just giving a definition to trauma-informed care for our folks who are not in healthcare? Trauma-informed care is huge in hospitals and social services today.
Yeah, I mean, I'm not an expert.
Yes.
But I will say it's the idea that many people have trauma from past interactions with the healthcare system, or from the way they grew up in terms of their communities or their family systems, and that coming into a healthcare system can re-traumatize them. And so it doesn't mean that everyone has trauma. It doesn't mean that there are no rules in healthcare or anything like that. All it means is that it may be helpful, as people come in and are acting a way that's different than the way you think you might act in a healthcare environment, that we are approaching with curiosity. And rather than saying, oh, what's wrong with this person? You're thinking more, hey, what happened to this person in their life? That this is the way that they're acting. And is there a way for me to partner with them and try to understand them and try to connect with them in a way that allows this to be a positive experience for them, or at the very least, that this is not re-traumatizing for them. And this is specifically, I mean, anyone can have trauma, of course. And again, I am not a trauma expert, but when we look at specifically minoritized or marginalized populations and the way that in American history they have been treated in healthcare, there are a lot of reasons why it might be that folks are not comfortable coming into a healthcare environment or have deep distrust or not have had good experiences before. And so I think it costs us nothing as healthcare providers, as clinicians, to approach with some empathy and some curiosity.
Well, thank you for that clarification, because you're right. There may be so many underlying and background stories that contribute to what's happening today. So that helps. So a couple more things leading into leadership. Um, who do you coach in the hospital system? How do you coach them around ethical issues? Because I know you have tons of people, tons of stakeholders you have to coach and guide in these difficult decisions. So who do you coach, and what are some things you do?
I coach anyone who asks to be coached. I think that,
Yeah.
as someone who is rooted in nursing, even though I provide ethics support for the entire hospital, I know a lot of nurses quite well. There are many nurses who I was supervised for years as a nurse manager. I think nurses are in a very unique and precarious situation in that they have the most intimate relationships with patients. They know the most about patients. And at the same time, they don't have the power to make a lot of decisions around care. So we could talk about moral distress. We don't have to talk about it right now. But I coach everyone, medical students, physicians at all levels, others. I would say the two biggest stakeholder groups, though, are physicians and nurses, because they're just the most of them.
Yes.
And I would say my coaching style is really around asking questions. I get calls from folks. Maybe you're a new to practice nurse and you are really intimidated by a very senior, seasoned physician, and you want to have a conversation with that physician about a patient care issue. Sometimes people will call and say, like, well, Aliza, can you have this conversation? Do you mind calling this physician? And my answer is always no, I'm not going to do that. But what are you worried about? And what is the outcome what is the question you want to ask? And what is the outcome that you're looking for? And can we together think through how to have this conversation, not only because it's inappropriate for me to insert myself into this two-person interaction, but also because I want you to know how to do this the next time you have a situation like this, because you're always going to have communication breakdown, situations where you don't understand what someone else is doing and you need to clarify. And so I think a lot of coaching is around that, just communication, how to have a good conversation, how to lead with curiosity. I do teach a lot of actual ethical concepts in the hospital. So things that we think of as much more sort of traditionally aligned with clinical ethics, right? Informed consent, surrogate decision-making, advanced directives, end-of-life decision-making. But I actually think the thing that I do most of the time is coaching around communication and curiosity.
One of the biggest problems in leadership. So that leads me to two final questions, kind of the summary. And you've said a lot of this throughout your discussion. Why is ethics so important to leadership and the leader, whether he or she is a clinical leader or non-clinical, healthcare, non-healthcare? Why is ethics so important?
Oh, Stephen, it's everything. I think that, so I will tell you by example. I have created at my hospital an ethics fellowship for frontline nurse leaders. These are the folks that are running the units. They're really doing the bulk of the work in terms of leadership at the organization, right? They are in it every day. They're overseeing staffs of 100 or 150 folks. They are talking to patients and families. And so they are really shaping the culture of the units where they're working, right? These leaders have an incredible capacity to create and shape culture. And in these situations, we need these folks to have a framework for how decisions are being made, for what the professional values are at the core of what we're doing every day. They're demonstrating leadership all the time, right? They're growing new leaders, right? I think about nurses or any healthcare professionals. Everyone is a leader. Leaders are happening at every level. And I think it's helpful for leaders to be able to, as soon as a new to practice clinician starts at the bedside, from day one, we need to tell them you're a leader. And we need to be teaching them how to think about what their obligations are to patients, to each other, to themselves, to their colleagues. Because if we don't have ethics, if we don't have a framework, if we don't know what our professional values are, we're not going to be able to make consistent, equitable decisions. And we're not going to have anything to guide us. We're not going to be able to shape an ethical culture. In an ethical culture, we're able to provide safe care, right? If we don't have a culture of safety, it means that we don't have ethics.
Yeah.
If we're not clear on what our obligations are, we're not going to be able to take good care of patients. We're not going to be able to keep clinicians at the bedside.
And that is so well said. I mean, for leadership, the shaping the culture, what's the framework of what you want to be as a leader, and then your organization looking at your professional values. What really well said. I guess my last question is, and I've kind of already asked this and you've already kind of shared this with us, but what do you see as the future of ethics in healthcare and, just where we're going in the future in our country and the world? That's really a big question. Wow.
I mean, I will take on healthcare.
Right. Healthcare. Right.
I think the future of ethics the argument for ethics needs to be made more clearly. And I do think that clinical ethics has a PR problem and always has. We aren't always good at making the financial case for why we need ethics in hospitals. The Joint Commission requires a mechanism for resolving ethical issues, but it's clear to me, and I've been in an ethics position for 5 years where my whole job is ethics. It's clear to me that many people in the clinical space do not understand what ethics is. There's this idea that we're the police, or that we're here to tell you what you're doing wrong, or again, that we're some kind of HR mechanism, which we aren't. We have great colleagues who are available with those skills, but it's not exactly what we're doing. And so I think we need to be able to decide as a profession, what are the metrics that we're measuring to show success? Are we able to consistently show things like, there's some evidence around ethics consultation, decreasing the length of stay in hospitals, which is a very hot issue right now, right? And increasing patient satisfaction, and sort of a lot of these metrics that we think of as important. I think because ethics is fairly new still, we kind of haven't completely figured out how we're measuring what we're doing. I think anyone who has worked with ethics or is called an ethics consult would say that it's helpful and it's clarifying and it helps the entire clinical team and the patient and family feel more supported. But I think the ethics is more important than ever. And we need to know why we're doing what we're doing. And I think especially when we're in a space where increased tasks may be delegated to AI,
right.
We need to really think carefully about how and when we're doing that and whether it's beneficial. And what the real ramifications are around that if we're now having patients who don't have as much interaction with humans. I think that's something we want to think really carefully about.
Well, and Aliza, that is our next podcast. So we're going to have to put our heads together for that.
Perfect.
So I can't thank you enough, Aliza Narva, the Director of Ethics from the University of Pennsylvania Health System in Philadelphia, Pennsylvania. Thank you for your time, your expertise, your knowledge. This is so important in this podcast and this journey for the next steps to leadership. So thank you so much for coming today. I really appreciate it.
I always love talking to you. Thank you so much.
So for all of those out there, if you need any assistance with ethics or ethical leadership or guidance, please feel free to contact my website, hrcvision.com. I'm again, Dr. O. Stephen Oliver in Leadership and Human Resources Consulting, and be happy to help you in your organization and bringing in Aliza. So thank you very much, everybody, for the coming today, and look forward to the next podcast.
You've been tuning into Next Steps to Leadership with your host, Dr. Stephen Oliver. You can find this show on YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, hrcvision.com. Thank you for your positive feedback, comments, questions, and for sharing the show with others.